His administration is right now suing in court, right now, to invalidate the law. Go tell a mother or father whose son or daughter has cancer and they can't get insurance because they no longer have the protection that is hysterical. Shame.
HHS. What is going on here? We're talking about lives.
Well, let's bring in Health and Human Services Secretary Alex Azar to talk about the president's health care policy. Mr. Secretary, thanks for the time.
Good to be with you, Brett. Thanks for having me.
You just heard Senator Schumer, Speaker Pelosi. Just moments ago, Speaker Pelosi put out a statement saying that the president's executive order is bogus and it's not worth the paper it's signed on, and it's an insult to every family relying on this pre-existing condition, health care. What do you say to that?
Well, first off, the president today announced a bold plan to deliver better care, more choice, and lower cost for the American people. And let's talk about pre-existing conditions. The president in his executive order today said it's the policy of the United States to ensure that people with pre-existing conditions are protected, whether under existing law or if there's any replacement ever passed. But let's be clear about the status quo, Brett. Right now, under this glorified Obamacare that many want to talk about, that they say protects people with pre-existing conditions, a family of two, age 55 in Missouri, making $70,000 a year, will spend $30,000 a year on premiums and $12,000 in deductible. I'm sorry, that's not the protection against pre-existing conditions. That's not affordable health care. That doesn't solve their problem. President Trump wants to work with Congress to solve their problems in a real way.
So when you say work with Congress, a GOP plan has been tough to really pin down since the effort to kind of dismantle and throw away Obamacare failed, and now it's obviously in the courts. There really hasn't been one GOP plan, has there?
Well, right now, given that the Democrats control the House, there's certain limited degrees of freedom in terms of what one realistically can achieve by legislation. So what the president's done over the last 3.5 years is revolutionize health care in the United States to deliver better care, more choice, and lower cost. He has done more in 3.5 years to help all 331 million Americans health care than any president in modern history. It's more than Obamacare. Obamacare is about 25 million people on individual insurance and in the Medicaid expansion. He's bringing transparency across the system, your ownership of your own electronic records. He's changing health care in a fundamental way that benefits every American, not just a sliver in Obamacare.
So if, as expected, the president gets his Supreme Court nominee through the Senate confirmation process, if, as expected, then that justice sits on the court and rules on this Obamacare case, what does the administration tell the people out there who are concerned that they won't have Obamacare anymore as they head into the dangers of COVID and flu season and everything else?
Well, I'll tell you what the president has said, which is first and foremost, he's going to make sure people with pre-existing conditions are protected, and he's going to replace it. He'll work with Congress as constituted at the time, if such a thing happens, with Congress at that time to deliver better health care for people. Obamacare didn't deliver for them. We can deliver really good quality health care for people. Better choice. Actually, you know, instead of the false promises that Obamacare just basically failed to deliver on, of keep your doctor, keep your insurance plan, all those lies that we're told, actually deliver lower cost, more choice, better care. You know, one of the things we did today, the president did today, for the first time in history, he has now allowed, as of today, the pathways for importation of lower cost drugs from other countries. No president's ever done that before. Every Democrat has always said when they've been president, oh, I'm going to do that, and they failed to do it. Today, President Trump did that, opening pathways for states to import, for individuals to import, and for low cost insulin to be re-imported into the United States where it is made.
I want to ask you one last question about the vaccine and the process. The FDA, the head of the FDA, speaking out about that, Dr. Hahn, about the process, and the president weighing in about how fast it's going to take. Take a listen.
Science will guide our decisions. FDA will not permit any pressure from anyone to change that. I will fight for science, Mr. Chairman. I will fight for the integrity of the agency, and I will put the interests of the American people before anything else.
I don't see any reason why it should be delayed further, because if they delay it a week or 2 weeks or 3 weeks, that's a lot of lives you're talking about.
If the FDA says we have to slow this down, is the administration okay with that?
If science and data and the legal constructs say slow down, then we slow down. But here's what we're doing. We're making historic progress with great speed thanks to Operation Warp Speed. We've taken the financial risk away from the process for the drug companies. And as a result, we now have 4 vaccines in phase 3 clinical trials. We have 2 public company CEOs for Pfizer and Moderna saying we could see clinical trial results by the end of October. We literally are making millions of doses of drugs as we speak at commercial size scale so that we could have 100 million doses of FDA gold standard vaccine by the end of the year. And we will not compromise on safety and efficacy standards. There are many independent checks, Brett, that are built into this system. An independent data and safety monitoring board decide if we even see data according to pre-specified endpoints. A drug company will then have to review it and consider the data according to their own ethical standards before even submitting an application. And then the FDA will call the balls and strikes by career officials according to the safety and efficacy standards that they have published publicly, and they're going to use an independent advisory committee to guide this. The American people should be reassured any vaccine that is approved by the FDA is going to be safe and effective according to the officials and standards of the Food and Drug Administration.
Mr. Secretary, we appreciate your time. We'd love to have you back.